So I think there's two ways, when we think about the role of the pharmacist changing over the next 2 to 3 years, I think that there are two sides to really take a look at that. There's a legislative and regulatory component that is really around the role of the pharmacist as a provider. And our public affairs team is actively working with a number of our legislative partners throughout the US around that particular piece, and clearly partnering with trade associations and the media and the NACDS team here around expanding the scope of practice for pharmacists. It's challenging because that will be different at each state level. We have a lot of experience with this with a number of the mid-level providers on the mainstream healthcare delivery side, so physician's assistants and family nurse practitioners and their expanded scope, and we're leveraging that experience to start talking about the broader dialogue. Beyond that, I think there's a real question around the role that the pharmacy technician can actually play inside the pharmacy and in actually delivering the care, and that we're not ultimately just shifting the prescription focus away from the pharmacist to the tech, but ultimately we're really thinking about the way in which the team comes to deliver care to the patient, with the core prescription business as a key part of that. So that's really what we're focusing on in general. The further ahead you look at it is that relationship is key. Healthcare has always been local, and the best types of healthcare interactions are where there are deep relationships between the patient and the provider. And for us, there is no better place than community pharmacy to do that. It's the deepest relationship. Some of these relationships go back 20, 30, 40 years between an individual patient. And one of my friend's grandmothers, for example, recently is getting care from this particular Health Mart pharmacy that we have that is in Iowa. And it was so amazing for me to watch that interaction, because that has happened. They've built a relationship over 30 years and at different stages of life with the whole family. And the way that that particular pharmacy is at the very center of the community, delivering care in a different way. Every single patient that came in the door, there was knowledge, understanding, there was a depth of discussion that doesn't happen in any other healthcare interaction. And for that reason, we say ultimately you have to begin with community pharmacy.